Welcome to The Explainer. Today we're setting out on a fascinating and, frankly, occasionally painful journey deep into the human body. We're going to track down a microscopic villain that causes an immense amount of suffering. We'll break down exactly how it operates, why it strikes, and what science can actually do to stop it.
Seriously, what if I told you that eating certain everyday foods could slowly create microscopic crystals right inside your joints? These crystals can trigger one of the most painful forms of arthritis out there, gout. Let's see exactly how it happens inside the human body using a 3D animation.
Section 1. The formation of crystals. Okay, let's dive right into this.
To really understand gout, we first have to figure out where these microscopic shards of pain actually come from. It's basically a three-step metabolic pathway. Step 1 begins with purines. Now, purines are natural compounds found throughout your body, things like adenine and guanine. We also take them in through our diet. Then, in step 2, our body naturally metabolizes these purines, and the end product of that whole process is uric acid. Now, here is where it gets really interesting. Uric acid is a weak acid, so in step 3, because the body's general pH sits around 7.4, this uric acid takes the form of urate, which is a negative ion. It then binds with all those highly abundant positive sodium ions just floating around in our extracellular fluid, and the result? Monosodium urate. This is the exact substance that precipitates and forms those dangerous crystals responsible for gout.
And this brilliantly illustrates a crucial distinction that honestly trips up a lot of people. Why do we get completely different types of crystals in different parts of our own body? Well, it all comes down to pH levels. Take uric acid, for example. In more acidic environments, like your urine, the substance just remains as uric acid. If it happens to crystallize down there, it causes renal stones. But in the slightly more alkaline, pH 7.4 environment of your blood and joints, it becomes monosodium urate. This specific formulation is the actual culprit behind gout. It's the exact same base metabolic byproduct, but an entirely different villain depending on the neighborhood it's hanging out in.
Moving on to Section 2, Causes of High Uric Acid.
So what causes this whole system to overload in the first place? Why do some people just have way too much of this substance floating around? The answer is hyperuricemia. This is the leading cause of gout. It's basically an excess of uric acid in the blood. When those levels push above 7 milligrams per deciliter, the fluid actually becomes saturated. Think of stirring way too much sugar into a glass of iced tea. Eventually, it just stops dissolving and starts gathering at the bottom, right? Interestingly enough, males generally carry a larger physiological pool of urate, sitting around 800 to 1,000 milligrams, compared to females who generally sit somewhere between 500 and 1,000.
Now, this saturation usually happens for one of two main reasons: overproduction or decreased excretion. Let's look at overproduction first. Diet plays a massive role here. Eating purine-rich foods like meat and seafood, drinking beer, or consuming a lot of fructose-heavy beverages seriously ramps up production. Also, certain diseases with high cell turnover, like psoriasis, can do it too. On the flip side of that, we have decreased excretion. Uric acid is primarily filtered out by your kidneys. So acute or chronic kidney disease, taking certain medications like diuretics, or drinking alcohol can seriously impair your body's ability to take the trash out. When you combine a bad diet, genetics, and poor kidney filtration, you've essentially built the perfect recipe for hyperuricemia.
Section 3. The 4 Stages of Gout. Let's move ahead and see how this builds.
Now that we know exactly how the weapon is forged, let's look at how the battle actually plays out over a patient's lifetime. You see, gout isn't just a sudden one-off event. It's a chronic, progressive disease. It starts completely silently in stage 1, the asymptomatic phase. Then an acute flare erupts in stage 2, which typically peaks within 24 hours. Once that immediate fire dies down, patients enter stage 3, the intercritical period. This phase can last anywhere from weeks to years. If it's left completely unmanaged, the disease eventually advances to stage 4, chronic tophaceous gout, which usually happens a decade or more after that very first attack.
Stage 1 is absolutely fascinating. It's often called the sleeping dragon. Get this. A staggering 95% of people with hyperuricemia will never actually develop gout symptoms. In fact, you could have monosodium urate crystals actively sitting in your joints right now, completely silently. So why is that? Because the human body is incredibly smart. It actually covers these sharp little crystals with a protective layer of proteins, effectively walling them off from your immune system. They just sleep there. But if that protein wall is disrupted, say by stubbing your toe, getting sick, or going on an alcohol binge, boom, the dragon wakes up. The crystals are exposed.
The second those crystals are exposed, your immune system's macrophages and neutrophils spot them and launch a violent inflammatory attack. And this brings us right to stage 2,
which is heavily characterized by something called podagra. This is your classic gout presentation, a severely painful, red, hot, swollen joint, most often right at the base of the big toe. It usually peaks within 24 hours and is so incredibly painful it routinely wakes people out of a dead sleep. Now, why the big toe? Well, it's at the very extremity of your body. Lower temperatures actually promote the precipitation of urate into crystals, making your poor feet the absolute perfect ground zero for an attack.
As the disease progresses into the later stages, chronic inflammation continues even when you don't feel the pain, eventually leading to permanent bone destruction and those deforming nodules called tophi. But there is a massive, silent threat we absolutely need to highlight here. 75% of people with gout also have metabolic syndrome. Gout isn't just a painful toe, guys. It is a giant, flashing warning sign for your overall cardiovascular health. The presence of gout means a significantly higher risk for cardiovascular disease down the road. It's a huge why this matters moment for anyone managing this condition.
Section 4. Diagnosing the joint pain.
So, if a patient limps into a clinic with a painfully swollen joint, how do doctors know for sure that it's our microscopic villain? Well, the gold standard for diagnosis is extracting synovial fluid directly from the joint and looking at it under polarized light microscopy. Now, what's really interesting about this is the visual contrast. Gout reveals itself as needle-shaped crystals. Because they're negatively birefringent, they appear bright yellow when parallel to the light compensator. But wait, there is an imposter. Pseudogout. It causes very similar clinical pain, but is actually caused by calcium pyrophosphate crystals. Under the microscope, these guys are rhomboid-shaped and appear blue when parallel to the light. It's an incredible microscopic showdown that completely dictates how a doctor is going to proceed with treatment.
Section 5. Treating and managing gout.
Once that diagnosis is locked in, it is time to fight back. And treatment is basically a two-pronged attack. First, we have the acute flare treatments. The immediate goal here is simply to put out the fire of inflammation. If you can catch it within those first 24 hours, you can significantly reduce the severity using NSAIDs like ibuprofen or specific medications like colchicine or corticosteroids. But then we have long-term therapies, because putting out the fire doesn't stop the dragon from waking up again later. You have to actively lower the urate levels in the blood. Doctors use first-line drugs like allopurinol, which blocks the body's conversion of purines into uric acid, or probenecid, which helps the kidneys excrete it way faster. And of course, implementing lifestyle changes, like adopting the DASH diet, which is heavily focused on vegetables and whole grain.
So the crucial point we have to mention regarding treatment is a bit of a surprise. If you have a gout attack, your first instinct might be to reach for a common over-the-counter painkiller like aspirin. Don't do it. Aspirin is specifically not indicated for acute gout flares. It actually has a paradoxical effect. It promotes renal retention of uric acid. By taking aspirin, you are effectively telling your kidneys to hold on to the very poison that's causing your pain in the first place, which can spike your serum urate levels even higher. It's a vital medical caveat that absolutely everyone should know.
We've journeyed all the way from a simple plate of seafood to the creation of uric acid, the building of a microscopic crystal, and the violent immune war that follows. So what does this all mean for us? What dietary choices could be quietly building microscopic crystals in your joints right now? Remember, 95% of hyperuricemia is totally asymptomatic. The dragon might just be sleeping, walled off by proteins, waiting for the exact right trigger. It definitely makes you think twice about how our daily habits interact with the invisible, yet highly complex, metabolic machinery operating inside us every single day. Thanks so much for joining me on this explainer, and keep questioning what's going on beneath the surface.